But Kristy, again, does the Liberal Party have the ability to call BS? I mean, there's been, in all of those debates, someone calling BS in and around Medicare, but the Prime Minister, even after it is said to his face in a debate, continues on with the lie, the shamelessness of the lie.
Well, look, it is a lie, and as Darren said, it was exposed in the first debate. There's not an Australian in the country who goes to a GP or goes to a medical service and doesn't have to pay, unless, of course, you go to a public hospital, which is funded by the states, of which doctors working in a public hospital don't have a Medicare number. So that point, you know, it's null and void Medicare. And I think the government hopes that people bank on the confusion between the cost shifting of health services, who pays for inpatient, who pays for outpatient. And so the point of that is the government's been very skilled at distilling their scare campaign into one message. Now, yes, that message is false, but the opposition hasn't distilled their rebuttal or their counterattack into something equally as simple. I've heard really good speeches from Anne Ruston yesterday, the Shadow Health Minister. I've heard really good speeches from Angus Taylor. I've heard the right narrative and I've heard the right sentiment, but I haven't heard the correct messaging that's simple, that's non-complex. And, you know, Tony Abbott was so successful. Stop the boats, axe the tax. Labor's been very successful. We're for childcare, Medicare, for rising your wages in the last 2022 campaign. There's been a vacuum of, well, what are those messages for the coalition? There's been really good assessments and really good speeches made, but it hasn't been distilled to that messaging framework.